Good morning, everyone. The next experiment or set of experiment that we are going to start, they belong to the cardiovascular pharmacology. As we have studied earlier on the various drugs which are used to treat various cardiovascular disorders in the theory. So in line with that only, we are going to study the drugs, how they are tested, what are the different models, the animal models which are available to test the activity of suspected drugs with cardiovascular effects. Okay, so the first preparation that we have over here, it is the uh, isolated heart preparation. Okay, so this isolated heart preparation, it is also called as Lagendorf's heart preparation. Okay, so when the word come Lagendorf, it means that a certain assembly which is used to test the drugs onto the heart, what effect they have onto the heart. Okay, so Lagendorf, it is not only associated with the frog heart, but it is associated with any other mammalian or non-mammalian heart that can be used to test the activity of drugs onto the heart. Okay, so it can be a rat heart, it can be a uh, frog heart, which we can use for testing the activity of drugs. Okay, so let's see what is there under this particular uh, uh, practical. So the purpose of it is to know about the cardiovascular system. So some basic concepts of cardiovascular system. Then second purpose, it will serve to know the effects of various drugs onto the isolated heart of frog. Then know about experiments on isolated preparations and in situ preparations of the frog heart, and know about the experiments on the isolated perfused mammalian heart by using Lagendorf's apparatus. Okay, so a few terminologies. First, we will study. The first one is the cardiac cycle. So it comprises of all the physiological events that are associated with a single heartbeat. So we have studied everything about cardiac cycle in the first semesters, human anatomy and physiology. Okay, so the atria and ventricles, they alternatively contract in each cardiac cycle, and it is divided into two phases, that is the systole and the diastole. So what is systole? uh, it is for the one who don't know about it till. So that's why the definition systole, it is contraction of heart. Okay, so it is part of cardiac cycle which happens right after diastole, when the heart muscle contracts and pumps the blood from the ventricles. So what is diastole? It is dilation of heart, and it is the part of cardiac cycle when the heart muscle relaxes in, and it allows chambers to fill with the blood. Okay, so the next terminology, we have the ionotropic agents or ionotropic drugs. Okay, so what they do, they affect the force of muscle contraction. Okay, so the positive ionotropes, they increase the force of contraction, that's why it is positive, and negative ionotropes, they decrease the force of contraction or weaken it. Okay, then second concept, we have chronotropic agents. Okay, chronotropic agents or chronotropic drugs or chronotropic substances. So what is chronotropic effects? These are those that change the heart rate. Okay, so it is associated with the heart rate, and ionotropic associated with force of muscle contraction. So chronotropic drugs may change the heart rate and rhythm by affecting the electrical conduction system of the heart, and nerves that influence it. Okay, so by stimulating a certain nerve like the vagus nerve, we can also change the heart rate. Okay, so vagus nerve, as we know, it is the parasympathetic efferent. Okay, so what effect parasympathetic system have on the heart? That it reduces or decreases the heart rate. And the sympathetic nerve, it is the cardiac accelerator nerve. Okay, so what effect does it have on the heart rate? That it increases the heart rate. Okay, so they it it can be the change in rhythm which is produced by the sinoatrial node. So as we know, as we have already studied, the sinoatrial node, okay, it is a pacemaker of the heart. So if we alter the pace which is created by the sinoatrial node, then we can change the heart rate. If we slow down the pace of the sinoatrial node at which it generates the impulses, then the heart rate will also reduce. If we increase the pace at which sinoatrial node generates the impulses, then we will increase the heart rate. It is like that. So the positive chronotropes, they increase the heart rate. The negative chronotropes, they decrease the heart rate. Okay. So next definition or terminology is dromotropic. So dromotrop, they affect atrioventricular node conduction. Okay. So it is all related to the conduction system of heart, and these almost all of these drugs, they affect the conduction system. Okay, so what they do, they affect the atrioventricular node conduction. Okay, so positive dromotropic, so what they do, they increase the AV nodal conduction. Okay, and negative dromotropic, they decrease the AV nodal conduction. Now you should be able to correlate this terminology with that of the antiarrhythmic drugs. Some of the antiarrhythmic drugs, they reduce the conduction velocity or conduction through the AV node, and such drugs we can call them as the negative dromotropic drug. Okay, so just to find out which drug affects the AV conduction. Okay, next concept we have, that is lucitropic. So lucitrop is an agent that affects diastolic relaxation. Okay, so uh, the drugs that will allow the uh, complete relaxation in the diastole, we can call it as a positive lucitropic. Otherwise, the incomplete relaxation, it is negative lucitropic. Okay, then we have the bathmotropic drugs. Okay, so what is bathmotrop? It is an agent that affects excitability of the cardiac muscles. Okay, so next is the cardiotonics. Let me tell you the drug we have already studied which acts as cardiotonic, and the name of drug is digoxin. Okay, so what these drugs do? These drugs, they increase the force of contraction of the heart and increase the cardiac output. So if you read this description of the cardiotonics, then uh, you should have the digoxin in your mind. Okay, because digoxin, as we have seen its make of action and the entire pharmacology of it, it does that. It increases the force of contraction as well as it increases the cardiac output. Now we will actually start with the experiment, is the to study the effects of drugs on the isolated frog heart. Okay, so principle. So there are several drugs which influence the heart rate, force of contraction, rhythm, and tone of heart, either as therapeutic effect or as an side effect. Okay, So many drugs used in cardiovascular diseases may act on the heart and have various effects like chronotropic, that is the heart rate, dromotropic, that is conduction velocity, then ionotropic, that is contractility, bathmotropic, that is excitability, and lucitropic, that is relaxation action. Okay. So continuing with the principle only, the sympathomimetic drugs, as you have studied in last semester, sympathomimetic drugs are the ones that mimic the action of noradrenaline at its receptor. Okay. So these drugs like adrenaline and noradrenaline, they increase the rate and force of contraction, and hence they are grouped as positive ionotropic and chronotropic drugs. Okay, so always remember sympathomimetics, they are positive ionotropic and positive chronotropic. Okay, so they increase force of contraction and they increase the heart rate. So there are few drugs like acetylcholine which decreases the heart rate, so it becomes the negative chronotropic. Okay, and also they decrease the force of contraction, and hence they are grouped as negative ionotropic and negative chronotropic drugs. Okay, so if you can see these two types of drugs, that is sympathomimetics and parasympathomimetics, their actions on the heart, they are exactly opposite. Okay, always remember the adrenergic and cholinergic drugs produce the opposite effects on heart through the respective receptor. So the adrenergic drugs, they will act on beta receptors, and the cholinergic, they will act on muscarinic receptors. Okay, so specific receptors, this beta is beta 1, muscarinic is M2 receptor. Okay, so by acting on M2 receptors, it will reduce the heart rate as well as force of contraction. So some drugs such as calcium chloride and potassium chloride, they act directly onto the heart. So what effects these drugs will produce, we will see in later parts of this slideshow. One second. So these are the requirements. First is the animal or tissue which we have to select is frog as an animal, and frog heart we have to isolate and we have to mount. The drugs which we are going to test is, the first one is calcium chloride, then we are going to use potassium chloride, then adrenaline, noradrenaline, isoprenaline, which is now known as isoproterenol, then propranolol, acetylcholine, and atropine. You should be able to tell category of each and every drug from this onwards. Okay. So next is the PSS. We have to use, that is frog ringer solution, specific for the frog heart. Then equipment, we have to use a chymograph with drum and smoke paper. No need to have the smoke paper because we use the like pen tip that can write onto the white paper. Okay, so no need to have the smoke paper. Earlier we used to have this, but now there is no requirement of it. Then starlings, heart lever, and the other things that we need is stand, syringe, beaker, stopwatch, dissection box, suturing needle, and the thread. Okay, so now procedure, it is a stepwise procedure. 16 17 points are there, how to prepare it all. Okay, so that all is given over here. I won't read it, you can read it and you can comprehend. Okay, so many things are there, but this is just the procedure that you have to follow. But I would like to show you a video related to this, that so that you will have more understanding of the things. Okay, so I'm moving forward. You can read it later on. Okay, so this is the assembly. So this is the reservoir into which we have to put the PSS. This is the screw clip which will regulate the flow of this fluid PSS through this tubing, which goes into this Symes cannula. Okay, so it holds the some amount of PSS, which is certainly less than this reservoir. And at the one end of this Symes cannula, we have attached the isolated frog heart. Okay, so at the apex part of it, we have attached the one end of the spring, and other end of the spring is attached to the starling's heart lever. So as this heart, um, it will be contracting and relaxing. We will get recording on it. Continuous recording we will get. But if we give the drug that increases the heart rate and the force of contraction, then these graphs will be certainly like this. Okay, so if we give a negative chronotropic ionotropic drug, then we will get a straight line. Okay, so this is the simple principle of this experiment. It is very simple to say as such, but when we have to do it, it requires some skill. Okay, so how to isolate it and which part of the heart we have to mount. Okay, so I will now show you the video. Just watch it. Okay, this video is related to we are isolating the rat heart, but the principle remains the same. Okay, see, we have attached the heart to the this Symes cannula. Okay, in Symes cannula there is PSS. Now we are tying the upper end of the heart with the Symes cannula. So it will be held in one position. Okay, so that was like a assembly part of the thing. Now with the help of software, they have shown what effect drugs will have onto the heart. Okay, so there is one particular software which is called as ExPharm Pro. Unfortunately, we don't have it. It requires subscription to the software, but as the video of it is available onto the YouTube, I have put that video into the slides. Just watch it. Okay, so you may have simultaneously the explanation of the things with that video. Okay, so this is the software.
Now I am going to discuss the procedure of the experiment effect of different drugs on frog heart. This experiment we will do in the ExPharm software. We will have to do the pharmacology experiment in the software. So for performing the experiment, we have to first click here. Then we have to click here. So this is the overview of this experiment. This is the drug selection part. So if we have to choose a drug and a dose, and we have to inject it, and the response is shown in this part. Now, to select another drug, we have to wash out the first drug. We have to click here for washing out the first drug. Then we have to select the second drug, and we have to inject it again. So first I have selected the drug epinephrine with a dose of 2 microgram. Then I have injected. So the response of epinephrine in the frog heart is shown here. That is baseline heart rate 65 and heart rate will 75 of epinephrine. Then I have to wash this drug. Now I have selected another drug, norepinephrine. I have to increase the dose, that is 3 microgram, and I have to inject this. So now the norepinephrine is injected into the heart of frog, and the response is coming in the black section. That is baseline heart rate 68 of norepinephrine and heart rate 64 of norepinephrine. So this is the response of norepinephrine in the frog heart. Now I will wash out this drug. The third drug is isoprenaline. Isoprenaline, I have to select it. I have to increase the dose, that is 4 microgram, and inject it. So as you have already seen, the response is coming in the black section. That is baseline heart rate 66 and heart rate 91 of isoprenaline when we inject it in the frog heart for a dose of 4 microgram. Then I will wash it. Then I have to select the next drug, calcium chloride, for the dose of 2000 microgram, and I have to inject it. So as you have already seen, the response is coming in the black section. That is basal heart rate 66 and heart rate 1. That is calcium chloride. So in this way, by selecting the drug, we have to perform the experiment. Again, I have selected one drug, this acetylcholine, for a dose of again 2 gram, and we have to wash this calcium chloride section. Then we have to select a drug, acetylcholine, for the dose of 2 microgram, and we have to inject it. So as you have already seen, the response is shown here. That is baseline heart rate and normal heart rate. Again, I have to wash this drug. I have to select another drug, potassium chloride, for a dose of 2000 microgram, and I will again inject this. So this is now the potassium chloride is going to inject in the frog heart, and the response is shown. Response is shown here. So in this way, we will performing this experiment. That is effect of drugs on the frog heart. Thank you.
Okay, so that was all. So you can see how this software works. We have to select multiple drugs, or then we have to select the dose, and we have to inject the dose. Okay, and once we inject the dose, it will give a certain effect, and then we have to wash that particular preparation, so that whatever remaining drug is there in the heart, it will be washed out. Okay, So like this we get a graph, and that graph we have to interpret. Okay, so this is the graph you can see, which I have got from the this particular software. So you can see normally how the uh, that particular graph looks like. When we give potassium chloride, then it is a straight line. Okay, then we give there is again normal graph, then we inject the calcium chloride and we get a straight line, but which is elevated straight line. So what is this elevation means is that this upper part of the graph, it represents systole, and this lower part, it represents diastole. Always remember, this will be the systole and this will be the diastole. Okay, so adrenaline, now apply this logic over here. Okay, so adrenaline, it increases both the systole as well as diastole. Okay, so we are actually noradrenaline, isoprenaline, then propranolol, acetylcholine, and the atropine. We have to uh, take out the inference from this graph, and this inference we are going to discuss in detail in next slides. So the inference about this particular experiment is that when potassium chloride and calcium chloride we give, they act directly onto the heart. Okay, so the potassium chloride, how much we have given, that is 2000 micrograms per ml. So what it does, it stops the heart in diastolic condition. That's why there is you if you have observed, the when we give potassium chloride, it stops the heart in diastole. Okay, so the liver records the response as the straight line on the lower border of the drum. Okay, so what about calcium chloride? Calcium chloride in lower doses, it increases the heart rate and force of contraction, but in the higher doses, that is 2000 picogram per ml, it stops the heart in the systolic condition, and liver records the response as straight line on the upper border of the drug. So you can observe it over here. It stops the heart in systole. Okay, so the upper limit is systole and lower limit, lower border is the diastole. So now next is the direct effects of the on the heart. They are determined largely by the receptors, although beta 2 and to a lesser extent alpha receptors are also involved. Okay, so beta 2 receptors, they are found mainly in the heart, where they are responsible for the positive ionotropic and chronotropic effects of catecholamines. Okay, so sorry for that, by mistake, I have said beta 1 receptor, uh, a specific receptor which is present on the heart. It is not beta 1, it is beta 2 receptor. Uh, Beta 1 receptor, it is present in the bronchial smooth muscles. Okay, so it results in markedly increased cardiac output and cardiac oxygen consumption. Okay, so noradrenaline, which is predominantly an agonist, it causes vasoconstriction and increased systolic and diastolic pressure with reflex bradycardia. Okay, so the isoprenaline, which is selective beta agonist, it strongly increases cardiac force and the heart rate. The adrenaline, it combines both alpha and beta actions. Okay, so beta adrenergic receptor blockers like propranolol, that does not produce any effect, but in higher doses they slightly decrease the heart rate as well as the force of contraction. Okay, so the presence of propranolol, the sympathomimetic drugs, they fail to produce any effects on the heart. So how it can be done? That when we have to add the propranolol first, and after some time, like 10-20 seconds, we have to add the sympathomimetic drug like adrenaline or noradrenaline to the that Symes cannula, and we have to observe the effect of it onto the heart rate and the force of contraction. So the ACH, it reduces the heart rate and force of contraction. In high doses, it stops the heart in diastolic condition, and liver records the response as straight line onto the lower border of the drum, same as that of the KC. So this effect is thought or it is through the M2 receptor, that is muscarinic receptor type 2, and it is found mainly in the heart. So you have to remember the locations of the various receptors, and then only you will be able to know that what effect these particular uh, drugs will have onto the heart. So the atropine, it does not have any effect except slight increase in the heart rate and force of contraction with sometimes. In presence of atropine, the ACH fails to produce any inhibitory action onto the heart. Okay, so with this, we have finished with the second practical of our pharmacology lab 2, and today we will stop over here only. The next practicals we will consider uh, in next, like in next practical sessions. Okay, so we will try to cover at least 2 practicals in a day, so that we will be able to cover all the practicals within the stipulated time. Okay, thank you. Okay, so I will just stop the recording.